Of course, we always begin with our land acknowledgement shown here. But who better to step in and give the Behrman lecture than Paul Wise, the Richard E. Behrman, MD, Professor of Child Health and Society and Senior Fellow at the Freeman Spogli Institute. So he's also co-director of the Stanford Center for Prematurity Research and a Senior Fellow, as I said, in the Freeman Spogli Institute. I think we're incredibly unfortunate to have the Behrman professor give the Behrman lecture, but also, as you can see from the title, there's a real sense of urgency here as we hear this presentation about what's happening at the border. And Paul also came and spoke to us in the earliest months of the pandemic about the implications of the pandemic and children in other countries and refugees and at the border. I just want to call your attention to the next few grand rounds. We're so fortunate to have Sean O'Leary from Colorado talking about strategies for communicating with vaccine hesitant parents, obviously something I think that's relevant to all of us. And then I'm really excited about the following week when we're going to hear from our chief residents on reviving the unexpected victim of the pandemic, resident education. And our chief residents have done an amazing job, and they're almost always front and center here at Grand Rounds, which we also appreciate. We are coming up on our celebration of the staff and faculty. Every year we do this. It's a wonderful event out on the lawn at CAM. It's a real celebration, and just want to make sure everyone's aware that this event will be on Friday, June 30th, the Staff and Faculty Awards, and you can see how many different categories of contributions we're going to be celebrating among the faculty and the staff. And then very, very important announcement about a really important change in Grand Rounds next year. And that is we're going to lose this auditorium for a while because of construction. And all of us have been putting up with construction noise during Friday morning Grand Rounds. And so after some surveys, thinking about different dates, different times, we're going to move Grand Rounds over into the Center for Academic Medicine. We're fortunate it's just across the street, but note it's going to be on Tuesdays. So same time, 8 to 9 a.m., but new place in the beautiful Grand Rounds room over at the Center for Academic Medicine on Tuesdays, starting on September 5th. And with that, Paul, I'm just going to invite you to come and take us from here. Thank you.
Richard E. Dick Behrman was a mentor to me, and in recognition of his leadership and contributions to this institution, the Richard E. Dick Behrman Endowed Lectureship in Pediatrics was established. Dick passed away in 2020, but many listening and here with us today remember well his many contributions to this institution, chairing both the boards of Packard Children's Hospital and the Lucille Packard Foundation for Children's Health. More broadly, Dick was both a physician and a lawyer, and was always committed to health equity, human rights, and to intense cross-disciplinary collaboration. His commitments lay at the core of his many contributions, and importantly to his training commitment, a commitment that has led to the development of generations of pediatricians who've come to embrace Dick's engagement across the disciplines, commitment to human rights and equity, and his devotion to the health and well-being of children in the United States and around the world. It's a real privilege for me to give the Behrman Lecture this year. And my title today is urgent, in many ways sad, but also compelling. Since 2019, I've worked for the federal court overseeing the treatment of migrant children in US detention, first as a special expert, and since last August as the juvenile care monitor for the Southwest border, particularly the two sectors in El Paso and the Rio Grande Valley. And in this role, I have been privileged to work with many lawyers from a variety of different disciplines. And as you can see from this slide, they have asked me to make sure that you understand that my presentation today is not as the juvenile care monitor, but as the Stanford professor. And rightly so. It's important to make this distinction. In my role as juvenile care monitor, I've been given full access to all Customs Border Protection, and for several years, all Health and Human Services migrant shelters. I'm the only external person who's been given access to these facilities. And because of that role, I cannot disclose any confidential information, any information that's privileged or sealed by the court. Today, I'm going to be talking about investigations into 2 deaths. And it's important to remember this disclaimer in that I will not be presenting any information that I've learned about these investigations, but we'll be happy to discuss it once the investigations have been made public. Everything I'm presenting today is in the public domain. I returned yesterday from the Rio Grande Valley, participating in the death investigation of this child. Anadith died on May 17th. It's an 8-year-old child who died in the US Border Patrol Station in Harlingen, Texas. It's in the Rio Grande Valley, Brownsville, McAllen area. Again, these are data, this information that is in the public domain. Most of it has been put out by the investigators in the Department of Homeland Security, Customs Border Protection. Anadith was apprehended as part of a family on May 9th. And as you can see from this slide, she was accompanied by mother, father, and 2 sibs. They were taken into US Border Patrol custody as part of a larger group, 47 non-citizens, migrants in Brownsville, Texas, in the Rio Grande Valley. And this is everyday occurrence. It was a increase in migrants crossing in Brownsville at this time. And you can see it was, this is a slide from that area where she was taken into custody. In the early morning, after taken into custody in Brownsville, the family was transported to the Donna Processing Facility in Donna, Texas. The Donna facility is the priority facility caring for children, unaccompanied children, and families in the Rio Grande Valley, traditionally the busiest sector on the southern border. As part of the usual protocol, Anadith received a medical assessment soon after entering the facility, and it was documented she had a history of sickle cell anemia and of cardiac surgery. This photograph is what the holding pods look like in the Donna facility. This was during this picture was taken when it was quite crowded. It is far less crowded now, but you get a sense of what these facilities look like. They're on sleeping mats with Mylar blankets, and we'll talk a little bit more about the custodial conditions in a minute. On May 14th, that's 4 days after she entered the facility, she was complaining of abdominal pain and a fever, and she went to the medical unit that's 24/7 at the Donna facility, had a flu test and was positive for influenza A. She was given antipyretics and Tamiflu as per the protocol. However, protocols also require that individuals in Donna, in the Donna facility, who have influenza or COVID or several other types of infectious diseases are sent to an isolation unit within the sector outside of the Donna facility. And that facility was the Border Patrol Station in Harlingen, Texas. And They were transferred on the 14th. And on the 17th, the mother told the medical staff, also located in the Harlingen station, that Anadith was vomiting, had fever, was seen several times by the medical personnel. Again, this is all public record. The mother reported in the press that she was adamant that her child needed to go to the hospital. This was in press reports. But at 1:55, while the mother was carrying the child, Anadith apparently had a seizure, and CPR was started by medical personnel and Border Patrol agents in the facility. EMS was called, but she was pronounced deceased soon thereafter at the local hospital. Now, this death is taken very seriously by the agencies responsible for the care of children in their custody. The Office of Professional Responsibility, OPR, within the Department of Homeland Security, Customs Border Protection, were the lead investigators. They're very experienced criminal investigators, and they were conducting their investigation rigorously while I was there. In addition, the medical units within Homeland Security and Customs Border Protection are actively engaged in investigating, particularly the medical aspects of Anadith's death. I'm confident that the results of the investigation will be released publicly, maybe relatively soon, I don't know. But I am confident that this will be a thorough, rigorous investigation, both on the medical side as well on the legal side. Now, we need to recognize that these families and these kids are caught in a vice, an ideological vice between the commitment to provide humanitarian care, but also the strong anti-immigrant concerns that are generating much of our immigration policy. And of course, it began to really take hold in 2016, 2017, 2018, when large caravans were coming primarily from Central America to the border. And traditionally, there have been larger numbers coming to the border, but traditionally, they're adult Mexican men who looking for work coming to the border. But what transformed beginning in 2014, but particularly 2019, was a shift from single adult men, families, and unaccompanied children. These are kids less than 18 years of age who come into custody across the border without a parent or a legal guardian. And the response has been primarily, this is under the international bridge, where numbers of migrants just overwhelm the holding capacity of Customs Border Protection, of Border Patrol. And the response is almost always, certainly in the Trump administration, but also in the Biden administration, has been a concern about deterrence. How do we deter people from coming to the border without authorization? And that impulse, that imperative, is in tension in many ways, not necessarily, but often is, with the humanitarian provision of custodial care. And the children, the unaccompanied children, their families, in many ways are caught between these tensions. And deterrence became most obvious and in many ways most infamous when, during the Trump administration, the zero tolerance policy was implemented, which basically said that families coming across the border, the parents are going to be considered to be in violation of criminal law. They're going to go to jail. Can't send little kids to jail. So it functionally meant separating the parents from the kids. This is the famous separation that took place. And the zero tolerance policy started as a pilot program in the fall of 2017 in the El Paso sector, but went border-wide very publicly in April 2018. And routinely, kids were taken away from their parents. Functionally, they were made unaccompanied children and put into the unaccompanied children pipeline going to Health and Human Services shelters as an unaccompanied child, and the parents would go to jail. What became apparent pretty quickly is that they hadn't really planned very well for this. And the computer systems for the unaccompanied children were not aligned with the computer systems for sending the parents to jail. And in many respects, they lost track of which kids belonged to which parents. Some of these kids were infants, kids less than 5. They don't know where their parents, they don't even know their names. They can't talk. And what you saw was a serious backlash very quickly to the separation policy, really across all political spectrum. And the backlash was so severe from so many different constituencies that the Trump administration, after 6 weeks of zero policy, rescinded the zero policy. However, it took many months for many of the children to be reunited. And to this day, there are still children who have not been reunited with their parents for a variety of reasons. Now, how is it supposed to work? Well, basically, Border Patrol is the usual means by which families and children come into US custody. When you go to an airport, there are people in blue, the immigration people and customs people. That's Customs Border Protection, the Office of Field Operations. They are the people that work in ports of entry, sorry. Airports, perfect example. Everything between ports of entry is Border Patrol. Okay, so all the land between official ports of entry is the arena of Border Patrol. Almost all the families and unaccompanied kids are looking for Border Patrol, give themselves up. They're not trying to evade. They are looking to begin the procedures seeking asylum or entry into the United States. And this is a typical scene of Border Patrol agent getting names, checking on the status of the kids in the field before they are transported to Border Patrol facility. And the numbers we're talking about here can have 500 migrants cross the river at the same time. And it's up to Border Patrol to make sure they're in okay shape, that they're not in need of an emergency medical response, but also to begin the procedures to bring them into custodial care. Now, there is a set of guidelines that determines the standards that Customs Border Protection, really all government agencies must abide by. And this is the Flores Settlement Agreement. And it was a lawsuit begun in the the agreement was signed by Clinton, Janet Reno, but was begun years before, basically saying that you need certain standards to take care of kids in immigration custody. And the Flores Agreement was signed and made sure and provided court supervision of the custodial standards. And the standards were pretty basic. It had to be safe and sanitary, and that unaccompanied kids and ultimately kids and families needed to be transferred out of Border Patrol, Customs Border Protection custody within 72 hours. Unaccompanied kids going to Health and Human Services. However, in late 2018, early 2019, there were 3 deaths in Border Patrol custody: Felipe, Carlos, Jacqueline. And that set off a new round of litigation, basically saying that the government was not meeting the Flores standards. And that created a new series of discussions. And the judge, Judge Dolly G, appointed a very prominent Los Angeles lawyer, Andrea Orden, as the special master to help mediate a new agreement with much more specific, extensive, improved standards of custodial care that needed to be implemented in these facilities. And I was appointed at that time to serve as part of this mediation as a technical expert to provide pediatric child well-being insight into what was required. And COVID hit, and things were put aside for a while. But this last summer, July 2022, a new Flores agreement was signed. And the new Flores agreement has a number of different provisions. This is public record. But each sector has to have at least one facility that is set up to take care of families and kids. We need medical support 24/7 in these facilities. We need to have adequate nutrition, everything from infants that requires soy formula, little kid food up through teenagers. Kids always say they're cold in Border Patrol facilities. There's a temperature range that they must be in. And the kids are given sweatshirts, sweatpants, jackets, beanie hats, whatever it is that they need to keep warm. There needs to be adequate quiet and light dimming. They won't turn off the lights because it is a law enforcement issue. For sleep, kids get showers. There needs to be appropriate sanitation. It's supposed to be a child-friendly environment. And Border Patrol hired caregivers. They're functionally daycare workers, because what you have is this peculiar situation where Border Patrol, which is the largest federal law enforcement agency, these are men and women in uniform, many wearing Kevlar vests and guns, running the largest daycare centers in the state of Texas. There's a mismatch of purpose and capability. And so the new Flores agreement included hiring daycare workers. And of course, the Border Patrol agents love having daycare workers in their facility. And part of the agreement was to appoint a juvenile care monitor to ensure government compliance with these new standards. And that's me. And I was appointed in August and have consistently, and my colleagues and friends here in the audience know I spent a lot of time on the border, making sure that there is compliance. My first report was actually filed publicly in January. This is the Donna facility from the outside. This is the designated facility in El Paso that cares for families and unaccompanied children. And again, this is the inside of what Donna looks like. This is the nursery area of the Border Patrol Donna facility, because these are unaccompanied kids. They come across the border, and obviously, a 3-year-old is not walking from Guatemala through Mexico. They generally come with another adult who is not a parent or a legal guardian. And the law states, and it's interpreted in a way that these kids are unaccompanied functionally. then they go off, become unaccompanied children in the pathway to Health and Human Services. You can see there are male and female caregivers in the background. And this is the nursery area. I was there 2 days ago. Weren't as many kids there, but they've continued to improve the amenities and things for kids to do in these areas. And the medical procedures are, number one, the Border Patrol agents are supposed to, and they generally do, see if anybody's in need of acute medical care in the field. They do rescues in the river. Very often, families and kids come across with significant health problems, exposure, dehydration, sometimes injuries, particularly going over the border wall. It's not uncommon to have a need to call an ambulance, take them for broken legs, broken arms. Coming into facilities like Donna, before they even get in the building, they get a medical screen, primarily from EMTs. These are all contracted medical providers. And they're basically looking for, is anybody need to go to the hospital immediately, but they're also looking for scabies and other kinds of lice that they want to treat on the spot before entering the building. And they have treatment facilities set up for those kinds of things. You then have a medical assessment where nurse practitioner or physician assistant will do a quick history or quick exam and document this in what is now a digital electronic medical record. Once they're in the facility, in the holding pods, there are clinicians available for if anybody's feeling sick or getting sick, and that's sort of sick call. And they will be accompanied to the medical area to be evaluated. At any time during any of these procedures, if somebody needs to go to the hospital, they immediately refer to the hospital, the local facility, either by ambulance or Border Patrol vehicle will take them there. And then before they are outbound, which can be deportation, getting on a flight back to Guatemala, or being released into the United States, or for unaccompanied kids going to an ORR, Health and Human Services shelter, they get a quick outbound screen as well. And the medical team structure is a nurse practitioner or physician assistant. And they have backup pediatricians and other physicians not on site for consultation is the standard structure. And then you have EMTs, agents, or medical assistants available to assist in the medical units. And there are usually multiple medical units in these facilities. Then along came COVID, changed pretty much everything. And the COVID protocols, which are named Title 42 based on our old time law, gave the CDC the ability to declare an emergency, and all immigrants coming across the border can be turned back. In other words, asylum claims are not necessarily going to be addressed. And systems were put into place to expel migrants under Title 42, either just moving them across back into Mexico, putting them on flights back to their home countries. However, unaccompanied children, UACs, were not ultimately eligible for Title 42. In the beginning, they were, but a court and then the Biden administration said they're no longer going to be eligible for Title 42 removals. And that has continued up until May 11th. And there was great concern that with the termination of the COVID expulsion protocols, there was going to be a mass surge at the border, because now their asylum claims at some level are going to have to be heard. And new protocols, new policies have been put into place to deter people from coming across the border. In fact, what we saw was a relative surge in the week or so before the termination of Title 42. And since Title 42 ended, it's been relatively quiet. Still, thousands of people coming across, but relative to what was expected and what was happening before, not so much. And you can see how these different deterrence policies have been implemented, and their impact as deterrence is unclear. Zero tolerance, the separation of children, as you can see, had a slight effect, but the real message from the separation experience is that cruelty to children should never be used as an instrument of immigration policy. Deterrence should not be accomplished by the mistreatment of children. And that remains an important bright line for everybody that works in this field. The MPP is the Migrant Protection Protocols, remain in Mexico. They take your name, get everything organized for you once you cross over, but then you're going to be moved back to Mexico to wait for your time with the judge. So instead of being released into the United States and having your time with the judge in the United States, you're going to wait in Mexico. And when your time comes, we'll allow you to cross to go to your hearing. That was effective for a while, but as you can see, not so much. Title 42 is associated with the beginning of COVID, and there was a dramatic drop. This is unaccompanied children. But you can see with the entry of the Biden administration, there was a dramatic increase. And look at the scale we're talking about. These are monthly numbers. 19,000, 18,000 unaccompanied children coming into custody per month. People don't realize the scale of what's happening along the border. And it has stayed relatively high ever since. And these are the numbers up through February. Again, there was an increase just prior to the termination of Title 42, but then it has dropped off. And we're watching very carefully how this is going to play out. And what has replaced Title 42? Well, a number of different things, but particularly what's called expedited removal. Now there's an app on your phone, CBP One, where migrants in Mexico are supposed to make an appointment at a port of entry for your initial asylum process to begin. And you can be in Mexico just over the border, and it opens at a particular time, and everybody's sitting there sort of like a Taylor Swift ticket. You're just trying to get in. And there are a lot of glitches, some of which they have fixed, but it's now via this app. But if you come across the border without authorization, almost always give yourself up to Border Patrol. You're supposed to have a rapid assessment of asylum claims while you're in CBP custody. So you're not being sent back to Mexico, not being released, but we're going to do this while you're in CBP custody. Families are eligible, but UCs are not. So families like Anadith's family was part of this expedited removal environment. And when it gets really busy, the amount of time families will stay in CBP custody may be quite protracted. Week, 2 weeks, unclear, we'll have to see. As long as the numbers are relatively low, this may be a week or so. But this expedited removal is the new environment. There's also deterrence playing out politically. This is El Paso. This is the Texas National Guard putting out concertina wire the day I was there. and this tension between adequate humanitarian provision, asylum capabilities, banging up against deterrence. I'm going to tell you about the second case now. On May 10th, Angel was in a Health and Human Services Office of Refugee Resettlement shelter in Florida and died. His story was he also began in the Rio Grande Valley, went to the Donna processing facility, as he's supposed to do. On May 5th, within 72 hours, almost all of the unaccompanied kids are moving out, really within 48 hours, was transferred to a Health and Human Services shelter overseen by the Office of Refugee Resettlement. This is in Safety Harbor, Florida. Again, this is all public record. It's out in the press or was put out in bulletins from government agencies. But on May 10th, Angel was declared deceased after being found unconscious in bed. The preliminary finding was death from a seizure. Again, it's very serious. Investigators are on top of this case, looking at what happened, both the medical management as well as the custodial and legal requirements that need to be addressed here. Now, how is it supposed to work? Kids come in, Border Patrol, Customs Border Protection, CBP, ports of entry, but most are coming in under border control. Within 48, 72 hours, the unaccompanied kids are processed by Border Patrol and then transferred to Office of Refugee Resettlement. And the ORR facilities are much better than the Border Patrol facilities. They're set up for kids. They have educational services. They have mental health counselors. They have pediatricians available. They're supposed to get a full medical battery of tests, immunizations. And ORR is at the same time vetting the household that has been identified as their family or sponsor or reunification. So ORR is responsible for vetting where they go subsequent to being released into the United States. And virtually all the UACs, all the UCs are released into the United States. But what happens to them when they get released? This Angel's death is clearly going to require careful assessment of the facilities, what happened in this case, the medical services, right from the point of contact with Border Patrol through the time he was pronounced deceased. But when kids are released out into the United States, who's watching them? They're released to a sponsor or family that they have been vetted. But recent expose in the New York Times found that many of these unaccompanied kids are working in extremely dangerous situations, basically on their own, often in meatpacking, construction, in relatively dangerous work. They're 14, 15 years old. And it underscored the lack of accountability, what happens to unaccompanied migrant kids once they're released and come out of Border Patrol and out of ORR custody. What we see basically is a fragmented systems of care. You have Customs Border Protection, you have Border Patrol and the Flores Agreement operating in places like Donna or the CPC in El Paso. You have ORR, Health and Human Services shelters operating almost completely independent of the CBP facilities. You have post-release services, the border NGOs who are struggling to keep up with the families, and who's watching and taking care of UCs once they're released into the United States. And one of the most frustrating things for me is that each area, both in terms of responsibility in government agencies, but also advocacy, has a tunnel vision siloed focus. When the New York Times expose came out, it became all about child labor. And it wasn't about the overall system for how do we take care of migrant kids in families, but particularly unaccompanied kids throughout these systems of care. If there's one thing that I would strongly advocate this government to address is the fragmentation of services. And if there's one thing that the wonderful people advocating for migrant children in the United States is to begin to work collectively, begin to cross disciplines, and demand a rethinking of how the overall system is functioning, but particularly how it should function as a unified system. Now, what do we do? One is there are clinical responses, and there have been a number of guidelines, protocols put out. The AAP has some very good ones. There's also the Migrant Clinicians Network, which has been committed for many years to the clinical management of families, children, and adults coming into the United States. The Specialty Care Access Network is a particular pediatric program designed to help migrant kids with significant chronic health problems find care in their destinations where they're going to be located ultimately. And this network has been in many ways cobbled together by committed people with minimal resources. And Lisa and others around the country are working very hard to find resources to actually create a system for these kids once they're released into the United States. And these are some of the locations where they have champions. They're now more extensive, where kids with significant health problems like sickle cell anemia, a child released into the United States can find appropriate specialty care. There are also legal and advocacy responses across the board. And again, these slides will be made available with these resources. Now, in taking a step back and thinking about what I've seen and the message I'm privileged to give as the Behrman lecturer this year, is that something very special happens to these kids when they cross the border. And speaking to these kids, hundreds and hundreds of these kids, the perception of time changes. It's transformed. When life becomes completely insecure, completely untethered, time becomes something that evaporates, nebulous. It becomes completely contingent. What happened 5 minutes ago may not relate at all to what's going to happen in the next 5 minutes. Total insecurity means your life is completely contingent. Sleep happens when it can. Security happens when it can. In these facilities, there are almost never windows to the outside. Day and night become blurred. Time becomes erased in many respects. Taking it even further, step back, Sartre noted that the present is in fact a kind of border. It's the border between what you were 5 minutes ago and what you're going to become in the future. And in many respects, yes, the border is a geographic demarcation in the sand, but it's also for these kids and families a demarcation of what you had to live through and what your future will become. That it's a border of time and, in a sense, a border of what we would usually call hope. And this notion of hope is more than a sentiment, sort of a touchy-feely pediatric emotional concept. On the border, hope is instrumental. It has become the currency of our immigration policies. A veteran Border Patrol agent told me that what creates surges and deterrence is hope. When there is no hope that you're going to be able to live in the United States, the consequences of you crossing the border are, without hope, that's deterrence. But if there is any hope that crossing the border will permit you ultimately to live a better life in the United States, then they will come. And we saw this over and over again, overwhelming the deterrent policies that have been in place. Hope is the currency on the border. With Title 42, it's about hope more than it was about COVID. Now, some of you, my close colleagues here, have heard me say multiple times that health workers, particularly pediatricians, are the ultimate inheritors of a failed social order. Sooner or later, the clinical expression of a failed social order will wind up in our clinics, on the wards, or in the morgue. And because of this, this has always given our community the opportunity, if not the responsibility, to create a narrative that speaks to the currency of hope, to the tragedies that can occur, but also the rule of law, which must also be present at the border like it needs to be every place else in the United States. And in many ways, I have found you come to love these kids. But how do you love 10,000 kids a month? Doesn't make sense, but you do. And how do you grieve for 2 children you never met? But grieve we must. And we do grieve. The death of any child is always a tragedy, but the death of any child from preventable causes is always unjust. Each week in this auditorium, major discoveries, new innovations in pediatric care are discussed. It's truly remarkable, the advances, the discoveries that take place. But as our efficacy grows, so too does the burden on society to provide it equitably to all those in need. And therefore, our grief must be followed by action. The death of any child is always a tragedy, but the death of any child from preventable causes is always unjust. There is a justice component to what we must confront on our border. And our grief must be followed by action. This must motivate us to act, but to act collectively, to break down our silos and act with what I would call in solidarity. And solidarity is never discovered. It is, in fact, created. And it's in this solidarity that will best guarantee that our programs, our policies, and our clinical care will prove both effective and just. I left time for questions, comments.
And Lisa Chamberlain, General Pediatrics. Thank you very much, Paul. As always, an amazing perspective and talk. To raise your call of bringing the fragmented system together, towards whom is our advocacy most effective? Is it towards the AAP? Is it general media? I mean, how would you prescribe us to raise a collective voice?
Thank you, Lisa. Well, my answer is you should call Lisa Chamberlain, because I know that's not fair, but it is true. And you know, because you get all the referrals, because the advocacy clearly has to be dynamic, responsive, and multifaceted. And The AAP is an important advocate and a voice for the pediatric community, but it's not the only one. And also, I know I've been speaking with AAP leadership about leadership focused on migrant kids, and they are extremely motivated to act and they've already been active in advocating with the Biden administration about the deaths, but also more broadly. I would start local. These kids are in our communities all over the United States, all over. It's not just the big cities or along the border, Texas, Arizona, California, they're all over. And look to your local service agencies, local churches, other religious organizations that are operating locally because they're here and they may be invisible and they should never be. But more broadly, definitely work to improve government policies to ensure the rule of law at the border, but also that the humanitarian standards that we expect are maintained. Regardless of your political ideology, you may be anti-immigrant, you may be pro-immigrant, but once these kids come into the care of the people of the United States, we take care of them. We take good care of them. And that message needs to cut across the intensely divisive political environment that we live in now. And there's a lot the pediatric community can do to give voice to that sentiment and provide the technical expertise to do it right. Any other questions?
Paul, there are a few questions that came in from the Q&A. This one comes from Dean Winslow, who you know is in the Department of Medicine, and points out that he served as the CDC Senior Advisor and CMO for the Southwest Border Migrant Health Task Force. He wants to know more about the average length of stay for families at Donna and other CBP sector stations. When he was serving, it was only 1 or 2 days before transfer, and curious the implications of that.
Yeah, Dean's a good colleague and friend, did a very important work, particularly during the pandemic in these facilities. Unaccompanied children, supposed to be less than 72 hours, it's closer to 48. Families, unless they're being immediately returned to Mexico, almost never have I seen it less than 48 hours, unless things are so overwhelmed in the facility that they are moving them out. And that may be when Dean was visiting these facilities, that the custodial conditions are getting so difficult that they're basically releasing families into the United States very quickly, sometimes after initial processing in the field, bypassing Donna when when they had thousands of people under the bridge, for example. But generally, the average is closer to a week. And when things are busy, we'll have to see with expedited removal what this looks like. But I can't really talk about what I've been seeing lately, but what's out in the public record and what the families have said once they're released is that it's going to be closer to a week or so. But it's very dependent on the local conditions and how busy it is. But CBP has rules they have to follow, and to follow those rules can take time. But regardless of how long they are in custody, we better be treating them right. Yes. Wait for the microphone, please.
There, when it got very busy in Donna, we had up to 180 days. So it happens.
Yeah.
The other thing is some of the parents actually paid for their kids to go to work in a garage or whatever.
How do you mean?
you pay for somebody, an uncle or somebody in the United States to actually accept the kids.
Oh, yeah.
And some of this was good. Otherwise, I mean, it's what you presented.
Yeah. Often unaccompanied kids are reunited with their parents, one of whom may be already in the United States. Sometimes a sponsor, which is a non-parent, non-legal guardian, will take responsibility. It could be an aunt, uncle, grandmother, an adult sib, and most often everything works out fine. But there are other kinds of relationships, and as the New York Times expose documented, too many times the sponsors may have multiple children under their umbrella of responsibility, and it was not picked up by the vetting groups that this looks peculiar, and it's basically a kind of trafficking environment. Something that should never be forgotten is the desperation of the parents in getting their kids out of the Northern Triangle countries, Salvador, Guatemala, Honduras, the highest homicide rates in the world, except for parts of Ukraine now and some Mexican cities. But parents could be so desperate that they take risks. And those risks sometimes involve the complicity of other adults in the United States. Thank you.
Paul, just last couple questions online, then we'll have to close. Nicole McKenzie asks about the efforts being made by the U.S. government to understand and address the disruptions in countries which are driving the migration, larger issue. And Katie Gabriel Cox asks a personal question around trauma-informed care. You talked a lot about the trauma of the families. How do you manage the feelings of helplessness and secondary trauma for physicians, yourself, and other direct witnesses of this at the border?
Yeah. The different U.S. administrations have done different things in the countries generating many of the migrants, and the countries will change. Venezuela, over the past year, has generated large numbers of families coming to the United States, in addition to the more traditional Northern Triangle countries. And Mexico, there are also large numbers of Chinese coming through the southern border, as has been documented publicly. It's public information. What they've done varies, but nobody would say it's been particularly effective. I've been working in Highland, Guatemala for 50 years. Seen a lot of administrations do a lot of different things. In many ways, and I lived there during the Civil War, the violence now is worse than I've seen. And the push of the migration is more profound now than any time since I've been working there. In terms of the trauma to the clinicians, it's important to get, first of all, good training, but also that's where solidarity becomes critical. Working together, addressing these issues together. For me, you got to be real honest. I find this work rewarding. This is a privilege. I can't tell you what I get from these kids. They are resilient. They suffer terrible tragedies, but they can be resilient, and they're funny and appreciative. And that overwhelms the sadness of dealing with hundreds and hundreds of families. And as an epidemiologist, dealing with the empathy that's always required, looking at p-values and time trends.
Well, thank you so much, Paul. It's an honor and a privilege to have you as our Behrman lecturer and our fellow.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.